My research is about women's health after they give birth, and we kind of differentiated that based on women's mode of birth, so whether they had a spontaneous vaginal birth, an assisted vaginal birth or a cesarean section, with the aim of kind of looking at how interventions affect women and affect their experiences of birth. I used the Lifelines questionnaires, so it was a nested cohort within Lifelines called Lifelines Road. And it was women of reproductive age, whether they'd given birth or not, and then they were followed up or asked to participate in further questionnaires. The level of follow-up data you have is great. Like, there's 3 generations of people within Lifelines, so actually I could look at the women in my data and look at their children and see how their childbirth experience affected children's health. So I think that's really important. The impact I hope to have with my study is to highlight how, even though birth doesn't necessarily change, because it can be an emergent case, you might not have a choice in how you give birth, the follow-up and the care you get afterwards is important. You go on the Lifelines research page and it's all laid out step by step who you need to contact, the steps you need to follow, the things you need to include, which I really appreciated. And also whenever I had any questions, I could send an email and one of the team would get in contact, which is really nice, especially when you're working with data. Sometimes it can be, weeks, or you have no idea what to include, but it was so structured, which was very pleasant to work with.